Hi, everybody. Welcome in. For those who are new here, my name is Angelina. I am a senior advisor of proactive marketing here, hosting today's masterclass alongside with Dr. Layton. Dr. Layton, how are we doing today?
Fantastic. How are you?
I'm doing great. Thank you. So today we are talking about how to treat athletes or those who have sports injuries, basically patients with an athletic background, methods of treating, different ways we can treat. So without further ado, Dr. Layton, please take it away.
So why work with athletes? Personally, I think it's fun. Getting involved with a sport you love, an activity you love, it just helps make practice. You get caught in the grind sometimes and lose a little bit of that fervor. It's nice to be able to do something that you enjoy and be with people that are like-minded, doing the same stuff. Athletes typically are more into active treatment versus passive treatment. So you have those people that like to come and, you do everything to fix them up. And they go home and they sit on the couch. They don't do anything else to help with their care. And they come back and they do that same process over and over and over again. It gets old. You have the active patients, so athletes. They care about their performance. They care about their physique. They want to feel good. They can't afford to have an injury. They're always trying to get ahead. If they have an injury, they want to get it healed as quickly as possible. So, athletes tend to care more about your treatment. So it makes sense. Because they're always wanting to get better, because once you get them good, they want to stay there. Athletes tend to understand maintenance care. So it's easy to keep those patients on track and keep them coming back. And obviously, it's good exposure for you and your practice community. So if people know that you're treating, whichever athletes or whichever team or whatever it is, it just exposes you to more people, whether it's the parents, the fans, whatever it is. So where do you begin? Your local orthopedist, your physical therapist, they don't necessarily want to treat everything that you do, but also having those people to refer to when you need to refer to somebody. Somebody has an injury that is beyond what you can do, or it needs something a little bit more. It's nice to have somebody that's in your hip pocket that you can refer to and say, okay, I've got a hand specialist. I work with a lot of Brazilian jiu-jitsu members. And so as they go and do tournaments, and sometimes, somebody breaks a hand or whatever it is, it's nice to be able to have somebody that you can refer to when you need to. Leverage your position with current athletes, coaches, gym owners, teams, organizations. So the people you have in your practice already, the people that you already know, the people in your circle, getting to know those people and using those people to network and get into those other groups. So if you know somebody who owns the gym, like here there's a group that owns a basketball court that's close by. So they do all this stuff really out of season for all the basketball teams. Plus they run all like the AAU tournaments. And he invites me up to be a trainer when they're short on trainers. So things like that. We have a running group that I would always go out and stretch the runners, work on them when they were getting ready for Chicago Marathon. So different groups like that, going out and volunteering. So it doesn't always have to be a paid thing. Sometimes it feels good to just give back to the community. So volunteering is good for that, but it also gets you out there without having to be paid. People appreciate you being there. Becoming a booster or sponsor for your local school, get noticed. So like my kids, where they go to school, I'm a sports booster. So I pay for my seats. That gets you on the board, but I also pay, there's a banner that goes up with my business's information, logo, all that they keep around the track by the football field. But they also did T-shirts for the kids, and so my business logo and information went on the kids' T-shirts. So doing the thing for the booster again helps get you out there. Then the athletes, they see your information and they know where to go. Going to the games and events, so it's not just enough to just give money or to just kind of financially be there. You have to be there physically too. So showing up, shaking people's hands, getting to know people, getting to know the coaches, getting to know the families, the other kids on the teams. And then as those people come in, getting the testimonials and reviews. So people can see who you've been treating and what you've helped them accomplish. So brush up on your orthopedic tests. You want to be confident and comfortable doing all that. So whether you're working on a shoulder, an elbow or wrist, a hand, a hip, a knee, an ankle, a foot, working on the neck, working on the back, make sure you know your orthopedic test and be able to do a quick assessment so you know what you're dealing with. And is it something that's in your scope or something that's not? It's a lot of extremity injuries. We see a lot of patellofemoral syndrome. One of the common things in sports, obviously, is running. So we see a lot of patellofemoral syndrome. So if you can help people rehab and get through that and help create balance in the quads and get their knees working better and be pain-free, people appreciate it. Your runners tend to be runners for life. So especially your older patients, as they get older, being able to help them through all those knee difficulties. You'll see the back and neck injuries, whether it's somebody that got undercut or took a big hit or whatever it is. So being able to address those, whether it's a whiplash, but then being able to pick up on concussions. We work with a lot of gymnasts, cheerleaders, whether they get dropped, somebody knees them in the head, doing they're doing a trick, whatever it is. And then having paperwork to help them out. So, maybe you need to get them out of gym class. Having forms like that already done, it helps. So teachers are aware too, because maybe they're going to be a little bit slower at school. They can't concentrate as well. So creating a form that addresses all that. And then doing your continuing education. You've always got to do your CEUs anyway. So doing CEUs around sports, whether you do a CCSP, so the Certified Chiropractic Sports Physician, you want to do an orthopedics, extremities, whatever it is, there's a lot of things that you can do that revolve around sports and working with athletes that will help leverage you with that community. So obviously there's a lot of treatment options you can offer the athletes. I know some people like to just do straight chiropractic and just adjust, but when you start working with the athletes and you want to be able to give them something more, they're looking to get better faster. So if you can do things to help them get there, they're going to appreciate it. So whether you're doing physical therapy, rehab, and I would say doing myofascial release, if you're doing scraping, so Graston, if you're doing massage, trigger point therapy, just stretching protocols, people that come in because their hip flexors are too tight, so they just can't run well. Ice and heat therapy, cold laser, E-stem, ultrasound, functional taping we use, and we've kind of covered a lot of these in a previous masterclass that you can go through and see a lot of these different modalities that you can utilize. But like the functional taping, we use KT and rock tape both. KT tape being more for like stabilizing a joint, and where we use rock tape more for functional movement. Cupping. Whether you're using the glass cups or if you want to use silicone cups, rock tape makes some really good cups. Acupuncture, dry needling. Dry needling is really popular right now. And you've got physical therapists that are doing it. There's no reason chiropractors can't be doing it. Just make sure that falls within your scope and the state you're in. And then nerve flossing. So all those things that help your athletes get better, faster, and make a better recovery. So benefits to the athletes, obviously, faster recovery. Access to a wider range of treatment tools. You can offer them a lot. So between the adjustments and doing Graston and doing taping and icing and teaching them a good exercise protocol, a good stretching protocol. So you're giving them guidance. You can give them proper nutrition that they should be doing, whether they need to increase protein, they should be taking magnesium as a muscle relaxant. Whatever it is that they need to do, you can help them with that. Just like anybody else that comes to your practice, you have an individualized treatment and integrate the treatment with the training. So if somebody's a golfer, maybe you want to be able to increase their rotation. So give them that individualized treatment. So maybe you want them to use TheraBands or resistance bands as they're going through rotational movements of the TL spine. And then sports-specific training, treatment, preventative and corrective exercises, strategies. We always want to give people a good stretching protocol so they know what to do at home. We talk to them about dynamic stretching, so what they should do before an activity to warm up the tissue, the joints. And then we also tell them, the static stretching is for after an activity. You have to loosen things up. We're big into foam rolling. So getting patients to do somewhat of their own myofascial release, but that's combined with the stretching component, the foam roll. So help your athletes out, get involved with their care, and help them excel.
Awesome. Thank you so much, Dr. Layton, for that presentation. I do want to ask, do you have any situations or stories of any significant experiences you've had when treating a patient with an athletic background that you want to talk about?
Yeah. Like I said, there's a group here that does the Chicago Marathon. It's called Team World Vision. We work with that running group. We've gone and we would go out and stretch them pre-COVID. We'd stretch them before their runs on the weekends. They did their team runs together. We would be out there with them. If anybody had any questions about, nutrition, stuff like that, we were there for that. All those athletes, as they would go run, if they came in and did an initial evaluation, we would also turn around and donate back to Team World Vision, so donate to what they were trying to raise for the Chicago Marathon. I used to give up all my Fridays and go down to UIC, where I'd gone to school, and treat all the athletes in the trainer's room. I've worked with LPGA players, or NFL players, NBA players, European basketball players. I've worked with college athletes in all sports. But recently we had a kid that was running track for the local high school. He'd strained his hamstring. This kid was a really good athlete. He wasn't sure if he was going to be able to be ready for conference. And so we were working with him. I told him to hold off on conference. He could still qualify for state without doing it. He turned around, he won the regional sectionals, went on to state, re-aggravated the hamstring, but won state. From state, then went on to nationals. We kept treating him, got him in shape. From nationals, he got picked up by the U20 team as a senior in high school, and was taken to the Pan Am Games down in Costa Rica and helped set a world record for 4x100.
Amazing. That's amazing. That's a really good story. Wow. Do you know how he's doing now?
He's doing fantastic. He's going to school at Purdue. He's
Nice.
on the football team, and he runs track.
Awesome. That's amazing. Amazing. You could even consider it a life-changing experience, depending on the kind of treatment you offer to a patient. So
Yeah.
That's really good to hear. Good to hear that's a beautiful experience for sure. Thank you so much for sharing, Dr. Layton. And again, amazing presentation. Thank you to those who came to attend today's masterclass, and I hope everybody has a happy new year. Thank you so much.
Sure.
See you soon. Bye.